So how do you get rid of that eyelid bump or eyelid pimple that is growing on the eyelid? Now, believe it or not, there are two main different types of bumps that we see commonly in the clinic. One is a stye. This is an infected oil gland, can be red, tender, sometimes painful, can look like a whitehead sometimes, or if you pull the eyelid down, you can see it deeper down in the eyelid, and sometimes can drain and include pus. This is an infection. This is called a hordeolum. Now, the twin is not an infected eyelid bump. This is called a chalazion. This type of bump is usually not red, usually not tender, can be a harder nodule that shows up there, and can be the top eyelid or bottom eyelid, sometimes deeper down into the tissue, and can be buggers to get rid of and can sometimes linger around for months. This is usually a trapped or clogged oil gland with buildup of oil and inflammatory proteins that just get stuck in there and continue to fill up, and so it can get bigger and bigger over time. So how does somebody get a chalazion? Now, a lot of these reasons can also be applied to the stye or the hordeolum. In fact, sometimes people can get a chalazion just from a stye or hordeolum being resolved. It can have leftover hardened oil that gets trapped within those oil glands. A lot of times people will just get this sporadically, meaning there's no rhyme or reason, it's idiopathic, but there are a lot of other things that does put you at higher risk of getting chalazions. And it mainly comes down to eyelid hygiene. One of the biggest ones is something called blepharitis. And there are a few different types of blepharitis. What it comes down to is that you have an overproduction of either your natural flora bacteria that's sitting on your eyelids and eye. Also, a combination of your oils and dead skin cells will collect on the base of the eyelid and the base of the eyelashes and will cause your eyelid to get inflamed, blepharitis. And this can cause the blockage to happen within those oil glands in the eyelid. One of the bigger causes that has a little bit more spotlight recently is something called Demodex blepharitis, where you have an overabundance of eyelid mites that live in the eyelash follicles that cause this inflammation of the eyelid and can be a direct link to the formation of a chalazion. Another portion to consider is eyelid hygiene. Now, a lot of this can be attributed to styes, hordeolums, infections, but a lot of this can also cause a chalazion, and this will be just poor hygiene, whether it's just as simple as rubbing or scratching your eye because it might itch, or it feels dry and maybe you haven't washed your hands, so you're just kind of introducing something into the eyelid flora. The use of eyelid makeup, using dirty towels, sharing towels with other people, or improper use of contact lenses, improper contact lens hygiene. There is a slightly increased incidence rate between the ages of 30 and 50, and it's more common in females, likely because of the use of makeup. Okay, so now for the meat and potatoes of this video, treatment. How do you get rid of a chalazion? And before we get into these treatments, one tip or warning is try not to pop it, squeeze it. You can definitely make it worse. In fact, if it's a chalazion and it's not infected, by popping or squeezing it can actually cause an infection. So just stay away from trying to squeeze that thing. We're gonna break this down into 3 tiers, starting with the safest and easiest. And this is probably where most people will fall that they can actually do at home. First tier, home remedies. The first thing you want to do right away is to do warm compresses followed by a digital massage. Now, with warm compresses, there has been research to find out what is the most effective way of doing a warm compress. You want this warm compress to be as warm as you can make it without burning the eyelid. It needs to have constant heat for at least 10 minutes. 15 minutes is usually the mark that you want to shoot for. And this is where the warm washcloth compress kind of breaks down a little bit, because sometimes that washcloth loses its heat about 2, 3, 4 minutes, and then you have to kind of reheat it. And it doesn't really work that well. It's not that effective. Now, this is where I'm going to lose a lot of you, but in the research it says to try and do this 3 to 5 times a day. Now, that doesn't seem like a big deal, but once you do your first warm compress, for some reason doing a warm compress really tests your patience level. At least for me it does. Now, the one key thing, the reason why I said you want to do this right away, because what they found, it's really only effective within the first few days, maybe the first week of that chalazion showing up. Now, a lot of times doctors, including me, will still recommend doing warm compresses to try and get whatever help you can to that clogged oil gland. But also at the same time, a lot of times I'll see people that get one chalazion or an eyelid bump. Sometimes we'll get another one later, or maybe now they get one on the bottom eyelid and now maybe one on the other eye. And so they kind of have this string of chalazions that show up. And so by doing warm compresses can sometimes help prevent another one from showing up. So I usually still recommend people to do warm compresses. Tier 2 is when you're going to go see your eye doctor, and this will include prescription medications, what your doctor can prescribe to hopefully get rid of this chalazion. Usually the moment when you know you need to go into the eye doctor is if you've tried warm compresses, digital massages, and after a few days, you're not seeing any improvement at all. Maybe you're at that week mark and you're wondering, hey, is this even doing anything? Yeah, that's when you want to go into the eye doctor to see if there could be some prescriptions that might help you out. A common prescription that a lot of doctors will prescribe is an oral antibiotic. Now, this might sound funny because a chalazion is not an infection, but one of the more common antibiotics is oral doxycycline. Doxycycline does have anti-inflammatory properties that work on the eyelids. In fact, sometimes we'll prescribe a low-dose doxycycline for people that have meibomian gland dysfunction. Their meibomian glands aren't really working that well, and can help them function a little bit better, help the inflammation decrease. And so by prescribing doxycycline can also help the inflammation, help the chalazion leave a little bit earlier. You also might have doctors prescribe antibiotic creams or ointments over the area of the chalazion. It really depends on how deep in the tissue it is. Sometimes eye drops or ointments have a hard time getting to that area and being really effective. But if there is some tissue inflammation surrounding the area, then sometimes a combo anti-inflammatory / antibiotic cream or ointment can be beneficial here. Now, tier 3 are in-office procedures that your eye doctor might be able to offer you. The first one is the use of IPL, or intense pulsed light. In the eye world, regarding dry eye treatment, it specifically can treat meibomian gland dysfunction, so it helps the oil glands where this chalazion is at. Now, sometimes this will need repeated treatments, sometimes 2 to 4 treatments on that area, but sometimes just that first initial IPL can reduce the chalazion down significantly, especially if you are in your early stages. And the other benefits you get with IPL can help the meibomian glands, can help dry eyes, can also help reduce Demodex, those eyelid mites that might be causing the chalazion. Okay, I need to jump in this video and add in another office procedure that I almost didn't put in here. And that's the use of red light therapy, also known as low-level light therapy. And the reason why I almost didn't mention it is because there aren't a lot of eye doctor offices that offer red light therapy, and you really need to use the therapeutic levels of red light therapy that you find in professional offices that are in-office procedures. You might find a lot of home devices, red light therapy devices, that maybe don't provide enough level of treatment or high energy level of treatment that would be beneficial for the Stye. So this really is an in-office procedure, definitely becoming more popular now, but might be hard to find depending on where you're at. Red light therapy works through a process called photobiomodulation. This is where it provides a specific wavelength of red light or near infrared light that penetrates the eyelid skin and goes deeper in there to stimulate the cell's natural healing process. And it can help a chalazion in a few different ways. It can reduce inflammation. It can help liquefy the blockage by providing a steady low-level heat to that area. And like I said, it promotes cellular healing and repair, and can also help with meibomian gland function that may help prevent any chalazia appearing in the future. I'll likely be doing a specific whole video about red light therapy, how it benefits the eyes, and what ways it can benefit the eyes. So definitely watch out for that video. I'll put the link in the description once it's out. So these next two in-office procedures are definitely more invasive. The first one is an eyelid injection. So it's an intralimbal injection. First, they will numb the area with a local anesthetic, and they inject a steroid into that nodule, into the chalazion, to reduce the inflammation and reduce the size of that nodule. Now, this can be really effective. Also, like IPL, can sometimes take multiple injections to fully get rid of that chalazion. The second one, the most invasive for sure, is something called an incision and curettage. And this is where you are getting into the surgical removal of that chalazion. They will apply a local anesthetic, take a metal clamp and kind of turn the eyelid inside out, make a little incision to drain all the contents of that chalazion, and then use a little scooper tool to scrape out the nodule and that cyst that's in there to completely clean it out so it doesn't return. Like I said, this is the more invasive way to treat this, but it can be really effective. And for people that just want this gone, or maybe it's been there for 6 months, multiple months, and just lingering around, this can be really effective, upwards to 90% effective depending on the study. So if I had to come up with a best prevention guide, this really boils down to eyelid hygiene. So you're gonna be washing your hands, limiting the contact to your face and eyes. If you can develop a routine use of either eyelid wash or eyelid wipes, either every morning or every night, cleaning off the debris that's in your eyelashes, reducing the buildup of extra bacteria, maybe even Demodex. This can be the best thing that you can do to prevent any chalazions in the future. Now, I have done videos, multiple videos on eyelid washes and wipes. I'll put a playlist in the description if you want to check it out. I also have links to my favorite eyelid hygiene wipes and washes, and some I have coupons for if you want to check out the description. These are ones that I still use every day. Another one is warm compresses. This is something that you can routinely do every day to try and prevent a chalazion. This can also help with dry eyes or meibomian gland dysfunction. Make sure you check in with your doctor to see if this is something good for you, because this can be a good help in the future. And then there's some generic tips regarding makeup. Try not to share makeup. Don't put makeup over your waterline. Make sure you remove your eye makeup every night before you go to bed so it doesn't sit there and clog your oil glands. You can also use hypochlorous acid solution spray to reduce the bacteria overgrowth on your eyelids. It can also be helpful for dry eyes as well. And then bottom line, if it doesn't go away or it's getting worse, go in and see your eye doctor. Now, if you've had a chalazion or a stye, I'd be curious to hear your chalazion story. How did you get rid of it? How long did yours last? If you're curious specifically about treating blepharitis, specifically Demodex blepharitis, check out my video right here or my playlist in the description. I hope this helped. Stay focused.